This presentation is on Benner's theory. She was born in Virginia. She earned her bachelor degree from Pasadena College. She then earned her master's from the University of California in San Francisco. And finally, she earned her PhD from Berkeley. In 1960, she worked as a research assistant at the University of California. Then in 1979, she became a project director at University of San Francisco, working on assessment and evaluation. And then since 1982, she has been working in research and teaching at the University of California. She has published 9 books and many articles, one of them which I'll be talking to you about today, Novice to Expert. In 2011, she was named a Live Legend by the Nursing Academy for notable contributions to nursing practice and research, and she is still currently a professor at the University of California. How Benner describes person, health, nursing, and environment. She describes nursing as a developing practices that focuses on providing accurate care to the individuals. She describes health as a personal experience in which everyone can have their own views on. And she describes environment as things that affect your health, such as physical, social, cultural factors. And person, Benner believes that the person is the individual receiving the care. So the theory I'm going to be talking to you today about Benner that she created is novice to expert. This concept explains how nurses develop skills from an understanding of patient care over time from a combination of strong educational foundation and personal experience. There are 5 stages, which I'll talk to you in the next slide, and each stage represents a progression in nursing skill and knowledge. So a novice nurse is the first one. This is a beginner nurse with no experience. The next one is an advanced beginner, and this person has prior experience and they're able to notice reoccurring components of nursing. Then you have a competent nurse, and this is someone who's been in the job for 2 to 3 years and they are able to experience day-to-day situations that they have before. Finally, second to last is a proficient nurse, and this nurse understands the situation as a whole and has a more holistic belief of nursing. And then finally, you have the expert nurse who has a deeper background and an intuitive grasp on clinical situation. Throughout each stage of the competency of Benner's model, each nurse should be expected to focus on some skills. So when a nurse is a novice skill, they should focus on mastering their basic nursing skills. Then when they're advanced beginner, they should continue to build their confidence within these more complex tasks. Then when they're a competent nurse, they should focus on redefining their ability to prioritize tasks and manage time. And when they're a proficient nurse, they should challenge themselves to take a step in leadership roles. And finally, when they're an expert nurse, they should focus on mentoring the less experienced nurse and stay involved in new research. So overall, Benner's theory has really changed what it means to be an expert in the nursing field. Her theory has now taken on this new beginning of being the best nurse as the nurse that can provide the best care for her patients. Here, Benner's theory applies to current nursing practice by providing framework to guide nurses' development as they gain experience, which allows for specific education and mentorship for these nurses. It has also allowed the healthcare organization to more better support their nurses in different career points and identify areas that need further training. Benner's theory applies to patient care by optimizing patient care by guiding nurses through stages of skill development, such as when they gain experience, they can improve their decision making, and which then allows them to provide better care. An example of how Benner's theory is used in a study. So it was a study created to show how novice nurses trust their ability to provide care in acute situations. The participants were asked to base the study on their trust in their own ability to make these clinical judgments. The results showed the most 2 important predictors in the ability for the nurse to provide the care that was needed was their work experience and their participation in acute situations. This directly relates to Benner's theory because she talks about how when you're a novice nurse to an expert, the most important thing to develop your skills is experience. So an example of different ways Benner's theory can be applied to clinical practice. The first one is clinical assignments. A nursing supervisor will do shift assignments based on nurses' experience. So novice nurses will get more easier, stable patients, while experienced nurses will get more critical, complex cases. The second way it can be applied is support for new nurses. Within Benner's theory, she highlights the importance of experience. So this has encouraged for more experienced nurses to guide less experienced nurses in order for them to get the support they need within their integration to working as a nurse. So what led to the development of Benner's theory? One of the main influence was the Dufresne's model acquisition, which discusses how people develop skills through experience, in which she outlines throughout her theory. Benner took this model and applied it to nursing, drawing from her own clinical practice. She conducted extensive research across clinical settings and observing different nurses, in which she discovered the importance of real-world clinical situations in shaping a nurse expertise, which you can now see her theory in the really popular book From Novice to Expert. So the last thing I'm going to be talking to you today about is Benner's contribution to education. She has now created a model that provides clear progression of a pathway for nurses to develop their skills from novice to expert. She exemplifies the importance of clinical experience within education, as well as highlights different learning strategies based on the student's experience level. And finally, she has helped education understand the different stages of clinical competence and how to support their students within each progression. Thank you for listening. I hope you enjoyed the presentation and learned more about Benner's theory, and I'm really excited to apply it to my research topic.